Hello, dear students. Welcome to GDC classes. In today's lecture, I am going to deal with the MCQs, the total 20 MCQs of the Pharmacy Act of 1948. Here we will be discussing what the MCQs mostly talks about or focuses upon, and then we'll go for the options. So let's get started. The very first question, and the even classic and cliche question, which you must remember when we are talking about the jurisprudence aspect. When did the Pharmacy Act came into force? When it came into force, they are asking you when it came into force rather than it is when it is passed. So there are several acts where the date of passing and date of getting an act into force is different. So you have to remember both the dates. 1st of January 1948, 4th of March 1948, 15th of August 1948 or 1st of July 1948. You must be remembering 1948 is a year, but the correct answer is 4th of March 1948. It is on this date it was came into the force. So you must be remembering that it was passed in 1948, but it came into force in 4th of March on 4th of March 1948. And now this again one important aspect to be known. If you are referring some old books before 2019, any books you are referring, you will be seeing that any act will be having this mention that act extends to whole of India except the state of Jammu and Kashmir. This is now incorrect because after the removal of the Article 370, now any act in the jurisprudence also will applied wholeheartedly or uniformly over all over the India, including Jammu and Kashmir. So do remember this particular thing. Question number 2, it is talking about the first central council was constituted by the central government. Central council, whenever I talking about, it is about the PCI, that is Pharmacy Council of India. That is our central council. And state specific council are there in all your states. Like if you are from Maharashtra, then it will be Maharashtra State Council. From Tamil Nadu State Council. There would be joint state council also between two or more states. So here when it is talking about central council, the central council is there. It is talking about the Pharmacy Council of India. Once the act came into force in 1948, just after year that, just after year, the Pharmacy Council of India was formed, that is 1949. To remember this particular thing. Question number 3, what it is talking about, the Pharmacy Council of India is constituted by whom? Central government, state government, parliament and legislative assembly. Just now I told you the central council is nothing but the central council is the Pharmacy Council of India. If it is a central council, that means it could be made by the central government. It is constituted by the central government rather than the state government. When I talk about state pharmacy council specifically, it has been constituted by the state government rather than the central government. You must be very specifically clear what is central government, what is state government. Central government is something or somebody or which body, the organization which will be looking all over the India on the nation aspect, on the national level, and whereas state government is more specifically associated with a particular state. Question number 4, let us see. Question number 4 is talking about the Pharmacy Council of India is reconstituted every dash year. 10 years, 1 year, 2 years, 5 years. You must be knowing this that Pharmacy Council of India is reconstituted every 5 years. So every 5 years there will be election and the body of Pharmacy Council of India will be having a different members every 5 years through elections. Next question is question number 5. It is talking about one of the ex officio member of the Pharmacy Council of India is Director General of Health Services, Government Analyst, Registrar of State Pharmacy Council and Director General of Veterinary Research Institute. You must be knowing it that the composition of Pharmacy Council of India is important. So there are 8 elected members, there are 9 nominated members, and ex officio members. When I talk about, there are 3 ex officio members. Among this, the first one is the correct. The Director General of Health Services is one of the ex officio members, and rest of them are not the one. The other ones are the Director of Central Drug Laboratory and the Drug Controller of India is the other two ex officio member of the Pharmacy Council of India. Question number 6 is talking about Pharmacy Act is divided into how many sections and chapters. So you must be remembering there are total 46 sections and 5 chapters. Okay, 46 sections and 5 chapters. So these are the chapters. First is introductory, second one is PCI, third one is State Pharmacy Council, fourth one is registration of pharmacists, and fifth one is miscellaneous. So the first one always remains to be introductory, the last one always remains to be miscellaneous. Rest apart you have to go from a national level to state level, and inside the state level registration of pharmacists. Question number 7, what it is talking about? As per the Pharmacy Act, the composition of Pharmacy Council of India, the total number of ex officio members. I just now told you, elected members there are total 8, nominated members there are total 9. When I talk about ex officio member, there are total 3 ex officio members when I specifically concerned with the Pharmacy Council of India. Question number 8, what it is talking about? The number of person elected as a member of Pharmacy Council of India from teaching profession. It is getting more specific. From teaching profession, when I talk about how many members are there? 5 members, 6 members, 7 members, 8 members. So you must be knowing that there are total 6 members from the teaching profession. You can see 6 members, including at least 4 are the teachers elected by the UGC. Okay, so 6 member you can very well remember. Choose the correct statement with respect to the Pharmacy Act of 1948. Education Regulation 1991 does not prescribe the minimum qualification for registration as pharmacist. Section 12 deals with the approval of course under study under Chapter 2 thereof. Section 12, the Act deal with the approval of course of study and examination under Chapter 2 thereof, and state government is authorized to make any rule with respect to the course of study. Here you must remember that Section 12 of the Act, this is the correct one, which deals with the approval of course. Okay, Section 12 deals with the approval of course of study and examination both. Not just study but examination also under the Chapter 2. Right? So there are some specific sections. You will be referring this. For reference, you can pause this video here. Can look at all these sections. Question number 10. What it is telling, which of the following is the ex officio member of State Pharmacy Council? Now here, be more specific. They are asking you State Pharmacy Council. So it is Chief Pharmacist of Government Hospital. Is it Chief Administrative Medical Officer of the state, Registered Pharmacist, or Assistant Drug Controller? You must be knowing that the Chief Medical Officer is the one correct answer. If I talk about the ex officio member, you can see Chief Administrative Medical Officer of State, Officer in charge of Drug and Cosmetic Act, and Government Analyst. These 3 forms the ex officio member of the state. Question number 11 says State Pharmacy Council should have the following number of elected members: 6, 9, 5, 7. Now here they are talking about State Pharmacy Council. They are talking about elected members. So don't get confused with the nominated one. There are total 7 elected members from the State Pharmacy Council. You can see 6 are from the registered pharmacist and 1 is member which is elected by the NCI Medical Council of India. So there are total 7 members from the elected category, and that too from the State Council. Question number 12, what it is talking about, the eligibility criteria for PCI member. Director of Central Drug Laboratory should be a registered pharmacist, ex officio member, elected by UGC and elected by the member of council. Now here they are talking about that eligibility criteria for PCI member. The Director of Central Drug Laboratory. The Director of Central Drug Laboratory, I told you in the ex officio member itself, There are 3 members. First one is the DGHS, Director General of Health Services. Next is the Drug Controller of State. And I also told you that is the Central Drug Laboratory Director is also one of the ex officio members. So option B will become the correct answer here. Question number 13, what it is telling about? The Register of Pharmacists, also known as Central Register as per the Pharmacy Act, contains what? Name of all persons for time being entered into the Register of State, public document, confidential document, both A and B. So obviously option D here will be the correct answer, because register is nothing but it will contain all the names of the pharmacist or all the names of the person for the time being who are there in that particular state. Even if you are changing the state, you will register there itself in the next state. So it is a public document. Why it is a public document? Because it can be referred by anyone. Okay, if there is information you need, so you can file an RTI, you can get the information regarding it. It is not as such confidential one. So do remember this thing. Okay. Next question, question number 14, what it is talking about? The number of registered pharmacists nominated by the respective state government in state council. In respective state government in state council, it is 6, 5, 7, 8. So you must be remembering this. 5 is the correct answer. When I talk about this, 5 is the correct answer. 3 to 5. Nominated 5-member registered pharmacists are to be there. The Education Regulation of 1991 prescribed practical training registration of pharmacists for 500 hours, 600 hours, 450 hours or 700 hours. Simply they are asking you that the Education Regulation of 1991 prescribe a practical training period, and you must be knowing it. 500 hours is the practical training hour, and this should be completed within 3 months. Okay, within 3 months should be getting completed. Question number 16, what it is talking about is every year after each state council should supply copy of its register to the central council after which date? 1st of March, 1st of April, 1st of May, 31st of March. So we know that after every 1st of March it is the duty. After every 1st of March it has to be supplied. The state government has to supply, or state pharmacy council has to supply this particular document. Where it go on? Let me find it out. 1st of April is our correct answer. Okay, so each state council is required to supply 5 copies to the central council as soon as after 1st of April every year. Question number 17, again the chapter 1. Here I have written the chapter for you people. You must be knowing it. Which chapter deals with the Pharmacy Council of India? I have been told first is intro, last is miscellaneous. Rather than we will go from center, state and then inside the state. So chapter 2 is our correct answer. Question number 18. The total number of state pharmacy council members are, total number of state pharmacy council 10, 15, 20, 25. So the correct option is option B, 15 members. How they are 15 members? Elected members are 7, nominated members are 5, ex officio members are 3. You can total it out. It is 15 in numbers. Question number 19, what it is telling? How many members from the Medical Council of India are there in the Pharmacy Council? How many members from MCI elected? It is one only. Only one members from the MCI. Do remember this thing. One member from the Medical Council of India. Question number 20, related to offences and penalties. The penalty for falsely claiming to be registered pharmacist, a fine up to 2,000, 6 months of jail for the second conviction, fine up to 500 rupees, rupees 500 for the first conviction and 1,000 for the second conviction, and imprisonment up to 6 months. So you must be knowing this. Very low conviction price is there. 500 for the first conviction, 1,000 for the next, and along with the jail term would be one criteria. So you can remember this particular table. If you are falsely claiming to be registered pharmacist, 500 fine for the first time you are breaching the act, and for the second time rupees 1,000 and 6 month jail term. Dispensing by the unregistered person, 1,000, 6 months, Failing to surrender the certificate of register 50 rupees, and for obstructing the state pharmacy council inspector 1000 and 6 months of jail term. So this was all about today's lecture. I hope you like it. If you like it, then kindly press the like button. If you have any doubts, then you can ask in the comment section very well without any doubt. Okay, so thank you so much. We'll meet you afterwards.